Welcome, everyone. Thank you for taking the time to be here today. Before we get started, we'll do brief introductions. Hello, everyone. My name is Isabel Aguilera, and I'll let my colleagues introduce themselves.
My name is Itemabong Alfred.
Hello, my name is Victoria Jones.
Thank you, ladies. So we're excited to share a lot of great information with everyone today. I'd like to ask that you hold any questions you may have until the end of our presentation. This way we can ensure all your questions are addressed thoroughly, and we'll have that dedicated time for Q&A at the conclusion. So let's get started. The purpose of our presentation today is to understand tuberculosis and help protect our communities.
All right. So our objectives today is basically to ensure that participants will be able to identify key symptoms and transmission methods of TB, understand how TB is prevented and treated, understand how health policy can help control TB.
And to get started, we will do an icebreaker. Would you rather TB version? And please scan the QR code so you can have access to the questions and answer it. There we go. All right. So the first question is TB screening. Would you rather a skin test or a blood test performed on you? And the next question is would you rather every 6 months you take medication or you are given one shot and face random symptoms for a day? And lastly, would you rather live in a world where everyone is tested for TB regularly or get TB vaccination? Next slide.
All right, so I'm going to talk about tuberculosis, and the definition is basically that it is a serious infectious disease caused by the bacterium Mycobacterium tuberculosis. The pathophysiology is that it primarily affects the lungs, but can also affect other parts of the body like the spine, brain, and kidneys. It spreads through the air when an infected person coughs, sneezes, or talks, and prolonged close contact is typically required for transmission. Next slide. And there are three stages of tuberculosis: the primary infection, which is the initial stage of exposure where bacteria enters the lung to multiply, the latent TB infection phase, and the active TB phase. So the latent infection, latent means existing but not yet developed or manifesting symptoms. So this is where the person has the bacteria but does not have symptoms and cannot spread the disease. However, a latent TB infection can progress to active TB. An active TB disease is where the bacteria is actively multiplying and causes symptoms. And this person usually feels sick, they have one or more symptoms, and they're able to spread tuberculosis to others and have a large amount of active TB germs in their body. Slide, please. What are the TB symptoms out there? Some TB symptoms are a bad cough that would last generally 3 weeks or longer, pain in chest pain, coughing up blood or phlegm from deep inside the lungs, and other symptoms would include weakness, weight loss, no appetite, chills, fever, and night sweat. Remember, TB can also affect other parts of the body like the spine and the kidneys, the lymph node, larynx, and the brain. Next slide. Who is at risk? Persons with weakened immunity are at higher risk of developing active TB once exposed to TB germs. Exposure to HIV infections, organ transplants, kidney diseases like kidney diseases, cancer, diabetes, and basically diseases that would weaken your immunity could put you at risk for tuberculosis. Also, frequent travelers to some continents like Asia, Africa, Latin America and those that live in large group settings such as prisons, homeless shelters, hospitals, nursing homes, correctional facilities, they are also likely, they're at risk to be exposed to tuberculosis. Next slide, please. All right, so we're about to do a quick role play to demonstrate how a health educator would interact with a person with tuberculosis. I'll pass out a scenario handout and I need 2 volunteers. One person would be the health educator and the other person would play the patient with TB symptoms. This will help us explore how to communicate clearly, offer support, and plan follow-up. There's no acting skills required here, so just jump in and let's have fun. I'll read the scenario. We have a 55-year-old woman presenting with fatigue, weight loss, night sweats, and productive cough that would yield blood-stained sputum. She just returned from a business trip in Thailand, and she has been experiencing the symptoms for about 3 weeks now and did not want to seek medical care due to fear of the diagnosis of TB. So the health educator will educate her, initiate testing, and ensure follow-up. Next slide. Now we have 2 types of TB test, the skin test and the blood test. The skin test is where the tuberculin is injected into the skin and you would need to return to the healthcare provider in 2 to 3 days to check the arm for reaction. The wheal must not be greater than 10 millimeters. The blood test measures how your immune system reacts when a small amount of your blood is mixed with TB protein. How do you prevent TB? Cover your cough or sneeze, wash your hands frequently, and prevent crowded areas. Treatment. Treatment plan includes medication taken to kill the TB germs. And it's important to note that to complete the treatment regimen, even if symptoms disappear, tuberculosis is a very strong germ and it takes a while for them to die of. And a few medications out there would be the rifampin or ethambutol, just to name a few.
As you guys know, knowing the critical data points is important. So about 10.8 million people fell ill with TB and 1.25 million deaths have been recorded, and that's including individuals who were diagnosed with HIV. TB is present in all ages, all race. It doesn't discriminate, so anyone can get it. And 79 million lives have been saved since 2000. And by 2030, we would like to end the TB epidemic. Next slide, please. This map shows the different areas where TB cases have been recorded. And from, as you can see, from lightest green to the darkest green indicate the number of TB incidents recorded. And the lightest one showing the countries with the lowest TB incidence rate and the darkest green highest. And as you can see, most of the dark greens are in the continent of Africa. And this is due to a high diagnosis of HIV. And as you know, people with HIV have a low weakened immune system. So that causes them to contract any kind of virus very easily. Next slide. This is a line graph showing the TB incidence rate, and is demonstrating individuals who have HIV and also diagnosed with TB. That's the red line right here. This black line shows the TB incident rate, and as you can see, there's a dip in the line in 2020, and it has been recorded that is possibly due to COVID-19 and the reduced rate of diagnosis and testing. TB fell from 7.1 million in 2019 to 5.8 million in 2020 and 6.4 million in 2021. And like I said, these reductions are seen to have resulted in the increased number of people with underdiagnosed and untreated TB. Next slide. And this is a global estimate of TB incidence. As you can see, the purple represent female and the orange represent male individuals who have been recorded to have TB. The highest burden is in adult males, and with an estimate of 6.01 million cases in 2023, which is equivalent to 55% of the estimated total. And there were an estimate of 3.6 million cases among adult women, equivalent to 33% of the estimated total globally, and 1.25 million cases among children ages 0 to 14, which is equivalent to 12% of the estimated total global TB incident rate. So as I mentioned earlier in our in the introduction of the critical data, that TB does not discriminate. Anyone can get it. Next slide. And this slide demonstrates the incident rates in the United States, and it has been categorized to US citizens and non-US citizens. And as you can see, the dark blue is showing cases among non-US born individuals. And you can see that it's about 6,500,000 people. And the lighter blue is US born individuals, and they have the highest TB incident rate compared to non US citizens. And again, you can see the dip in the graph, and that's around COVID time, and that's when things were underreported. Next slide.
Thank you. As we looked at that critical data and graphs, we can see how tuberculosis is a public health burden and really why it's important to have public health policies for TB control. So we have a couple of things, right? We have our surveillance and reporting. And all states require that mandatory reporting of both confirmed and suspected TB cases to local and state health authorities. This reporting is essential to track TB trends, detecting outbreaks, including those involved drug-resistant strains, and guiding timely public health responses. The data collected through surveillance not only supports outbreak response efforts, but also informs policy decisions. And ultimately, it plays a critical role in shaping effective TB prevention and intervention strategies at both national and local levels. We also have our case findings, which strong public health policies are essential for addressing the serious threats of drug-resistant tuberculosis. These policies support early detection to help further transmission through rigorous infection control measures and to strengthen the global response. And policies must also promote cross-sector collaboration, also remove barriers to care, and ensure ongoing monitoring and evaluation to expand access as well as impact. And then lastly, we have our treatment management, and we have our DOT, right? Directly observe therapy, and a key public health strategy in which a healthcare worker or trained individual observes patients taking their tuberculosis medication to ensure adherence and treatment completion. We also have our drug-resistant TB. So strong policies are really essential for early detection and effective management of drug-resistant TB strains, which presents a significant threat to public health. Then we also have infection control, which is a comprehensive infection control policies that are critical in healthcare and as well as congregate settings to prevent airborne transmissions. And these measures include proper ventilation, airborne isolation protocols, and the use of appropriate respiratory protection. We also have challenges as we mentioned earlier, we had the COVID-19 pandemic and had major impacts on tuberculosis control efforts. It disrupted diagnostic services, it hindered case detections, and it led to the decline in the initiation of treatment. So these setbacks contributed to an increase rate of TB cases and deaths in some areas. And additionally, the widespread disruptions to health systems, such as the reduction in vaccines coverage, as well as the suspension of TB screening programs that really hampered the timely diagnosis and treatments that allow diseases to spread more freely, right? We also have our drug resistance, which is the emergence of the multi-drug resistance and the extensively drug-resistant tuberculosis. And those have really made treatment more complex and costly as these strains are resistant to standard medication. As a result, patients face longer treatment durations, higher pill burdens, and an increased risk of toxicity and side effects. And then lastly, we have our disparities where tuberculosis disproportionately affects vulnerable groups, including people living with HIV, homeless, but due to factors such as limited access to healthcare, overcrowded living conditions, weakened immune system, and socioeconomic challenges, these conditions not only heighten the exposure of TB causing bacteria, but it also increases the risk of active disease. So, what can we do? What are our recommendations? So, we can really invest in prevention and treatment. So, scaling up our prevention treatment. We can also strengthen our surveillance data, finding new ways to track. And lastly, integrated care. So promote integrated people-centered care to really help address those determinants of health needs. So what does future state look like? So we can accelerate the decline. So policies must focus on accelerating the decline in TB incidences to meet those global targets. As we mentioned earlier, we want to end the global TB pandemic by 2030 with goals of 90% reductions and in TB death and 80% reduction in TB incidences by 2030. We also want to prioritize health equity, right? Really prioritize our efforts to address health disparities by targeting populations at highest risk and ensuring equitable access to care. We also want to mobilize and sustain support. So engage our stakeholders and our affected communities to build and sustain support for TB elimination efforts. And then ultimately, research and development. So continue to invest in research for new diagnostic, drugs, vaccines to achieve and track progress towards elimination. So as we're reaching the end of our presentation, let's check our knowledge. I'm going to be passing out a Teach Back activity handout. So please choose a partner and teach them what you learn. Teach them the 3 main points and 1 example of how a health policy can control TB. Have your partner repeat what you taught them, and then you can utilize this worksheet that I'm going to be passing out to help put your points together. And then if I can have just a few volunteers to kind of share, that would be wonderful. So as a quick recap, we talked about understanding TB, some of the symptoms and risk factors, challenges and disparities. We talked about public health impact and response, and also those policy needs. If you would like additional information, you can go ahead and take a picture of the screen. These are great links to inform yourself just a little bit more. All right, we have reached the end. If anyone has any questions, this is the time dedicated for questions and answers. If no questions, we would love to hear your feedback on how to improve our future presentations. So please scan the QR code. If you prefer a physical copy, we will also be passing those out. So those are available. For those that would like to scan the QR code, I'm going to leave the screen up for just a couple of seconds. So thank you again for joining. We appreciate your time. Have a great rest of your day. Bye, everyone.
Bye.
Bye.